Welcome back to my channel. So today we have a new topic on rosacea. So this is a condition of skin basically where a lot of redness and other complications are seen in this particular skin disorder. So let me give you more details about what exactly is rosacea, what are the signs, symptoms, causes and many more things today. So as I told you, rosacea is also called as acne rosacea. It basically causes redness, small pimple like red things, pus filled sometimes, and usually this affects middle-aged women who are fair in complexion. So usually around the age of 30, women basically may get affected by this. This is rarely seen in males but predominantly seen in females. So basically if you leave this untreated, it can become worsened, the symptoms can become worsened, and basically there is no cure as of now, but there are few tactics by which you can try to avoid or try to reduce the complications of this particular condition. So worldwide approximately 1 to 20% of the population is suffering from this particular condition, and this food, basically most of these like dairy products, too much spicy food and caffeine and drinks, all these should be avoided, because when you're taking all this, the chances of this flaring up becomes much more higher. Apart from that, even sunlight exposure makes the skin more vulnerable to this condition. So these are the few things that you can try to avoid. So coming to just to give you some clarity about the difference between psoriasis, eczema and rosacea. The first condition here shown is a psoriasis condition. So this is again a skin disorder, but you can see very much difference between psoriasis problem, eczema condition and rosacea. So this is how particularly rosacea looks like. And in case of eczema, you can see this is basically, usually it happens in the cheeks, arms, legs, so in those regions. But rosacea usually affects the face. Basically the nose, the cheeks and the chin. So this is the area which is usually affected. And in case of psoriasis, it is the elbows, knees and scalp. So this is the area which is usually affected. So based on the location, the dermatologist will be able to understand, and based on the condition, like how it looks like, based on the visual interpretation, they can get to know if it is a case of psoriasis, eczema or rosacea. So coming to the types of rosacea, there are 4 different types, type 1 to type 4. So in the first condition, the skin becomes red and the blood vessels will be usually visible. Okay, so it looks something like this, redness in the skin with a lot of angiogenesis, that is the new blood vessel formation, which leads to the appearance of blood vessels in the face. In the second case, there is basically papules, that is like pimples, which looks like pimples, and pustules. Okay, so these are the usual things which are seen in case 2 or type 2. Okay, in type 3, what happens is you might have hardened bumps, like thickened areas in your skin, something like this. Okay, and it usually affects the nose also. So hardened nodules on the nose, it looks something like this. And in type 4, it even affects the eyes and eyelid. So you can see this. So there will be complications even in the eyes. So these are the 4 major types of rosacea which is commonly seen. But now even there is something called as steroid rosacea, where due to long time exposure of corticosteroids, so basically when somebody is getting treatment for dermatitis or vitiligo, the doctors usually recommend steroids, okay, some kind of steroids, but long-term usage of these steroids has led to a side effect like steroid rosacea, which is commonly seen in nowadays scenario. So coming to the symptoms, as I told you, there will be facial blushing or flushing. So basically facial blushing means your face in that area looks red. Okay, and telangiectasia, this thing basically is your blood vessels, the tiny blood vessels which are present on the face, they start appearing on the face. Basically you can see it. Okay, so this blood vessels becomes visible properly on the skin. So that is because of extreme angiogenesis in that area. And apart from that, you can have swollen bumps called as papules. These are solid red bumps, usually in the form of clusters, which are usually seen like this. Or you can have pustules. Okay, in this case they will be even pus filled with that. Okay, so that is the main difference between papules and pustules. Okay, so here there is no pus filled, but here there is pus filled in it. And apart from that, they may have a lot of burning sensation because of the redness and flushing, and they can have eye problems that we saw in the type 4, and the enlarged nose, which is called as rhinophyma. Okay, so because of the hardened area in the nose region, it looks something like your nose is enlarged. So coming to the causes, so basically it can be genetic, it can run through families. One more reason is due to sun damage, your blood vessels might become wider in the facial region, and because the blood vessels is becoming wider, they appear on the skin. So you can see those blood vessels on the surface of the skin. Apart from that, they've also seen that one more cause for this is mites, and that is Demodex folliculorum. So this is a mite which is usually seen on the skin surface. But what happens in these people who are suffering from rosacea, their skin becomes extremely sensitive to this particular mite. So the sensitivity of this skin to this particular mite will lead to redness and other complications, because once we know we become sensitive, our immune system becomes active, which can lead to a lot of immune response, because of which it can lead to inflammatory conditions. Apart from that, I've already also seen that Helicobacter pylori, so this causes a lot of skin flushing, and the reason for this is it produces a lot of digestive hormone called as gastrin, which leads to this flushing condition. So these are the common causes for rosacea. So coming to the diagnostic options, so basically who can help you is definitely a dermatologist. So he can examine the skin, he or she can examine your skin and see if it is a case of eczema, psoriasis or rosacea. Once they diagnose it properly, like what exactly is the condition, in case you have the redness in your eyes and other complications also, he may suggest you to go to an ophthalmologist for further evaluation. And certain times they even do the serum analysis. So increased serum and tissue inflammatory mediators, that is particularly in this particular case IL-17 is analyzed, and that is checked using ELISA. We already know what is ELISA, enzyme linked immunosorbent assay. So using this procedure of ELISA, they can find out the levels of these inflammatory mediators in a person, and higher levels of this inflammatory mediators will indirectly tell you that the person is suffering from rosacea. So these are the few diagnostic approaches which are available for the analysis. And coming to the mechanism, what exactly is happening? So here in most of the cases, the triggering factors is sunlight, alcohol and stress. So these are the three main triggering factors for the IL-17 pathway. And there are a lot of things which are shown here. I don't want you to complicate or try to complicate this particular pathway, but basically I have told you about the mites and the Helicobacter pylori. So those are the main things which are leading to problems. And angiogenesis is basically the formation of new blood vessels in the facial region, basically in this particular case of rosacea, which is leading to more and more blood vessel formation, and even the sunlight is affecting the blood vessels, making it wider, which is leading to its appearance in a more predominant way. And again we have seen inflammation, pustules, all those in this particular condition. So what happens is basically your immune system is getting activated because of these conditions, and once your immune system becomes active, most of the inflammatory molecules are released, which can lead to this inflammation. So this is just to show you how neutrophil action is happening, basically your immune system action, which is leading to pustule formation. So in this way, all these conditions are leading to this complication. So basically if you try to have some azelaic acid, so these are the treatment options which are usually recommended by doctors. So once these kind of either some drugs or some azelaic acid, so those kind of things are recommended, they block some of these pathways. So once they block some of these pathways, what is happening is, once the pathways are blocked, these things will not happen in a predominant way. Okay, so that is what basically I wanted to make you aware in this pathway, that whatever the doctors are suggesting you, they will try to block some of these pathways which are leading to these complications. So in case we are able to track this or block this pathway somehow, these things can be avoided. So coming to the treatment options, usually topical drugs are recommended for the flushing of the skin which is seen. Apart from that, they may even recommend certain oral antibiotics. So basically this is the antibiotic which is recommended. So that is based on the severity. So how severe is the condition? Based on that, the dosage of this particular antibiotic might be varied. Apart from that, certain oral acne drugs are available in the market, but I please recommend you not to use it during pregnancy, because there are cases where they have seen that it led to birth defects in kids. So it's always better to consult your dermatologist, and please don't take self-medication. So that is leading to a lot of complication these days. So please consult your doctors, and then only based on their suggestions take the suitable antibiotic in the particular dosage. And one more thing is azelaic acid can be used. They are available in gel form and foam form. So this will help in clearing of bumps, swelling and redness. And usually pH balanced skin cleansers are recommended in opposition to soaps in these particular patients. Okay, and certain times a dermatologist may recommend a cosmetic procedure like laser therapy. So that will help in reducing your enlarged blood vessels. So this image is just to show you a condition of a patient before the treatment and after the treatment. So it is very evident here. So you can see the blood vessels which are raised here. This was before treatment, and after the cosmetic therapy, that is laser therapy, it is it is almost gone. You cannot see those blood vessels here. So that is the beauty of laser therapy, but definitely you have to choose the right dermatologist and the right person to do these kind of therapies. Apart from that, certain times people think of having certain home remedies. So basically I just want to tell you that you try to avoid sunlight as much as possible. Try to protect your face from using sunscreen, SPF 30 at least, and you should always treat your skin very gently. So we have seen people that once they get pimples, they start pinching it, or they have this redness, they start rubbing their face so hardly with the soap and other things that even triggers it more. Okay, so you have to be very gentle when you treat your skin. And you can go for alternative therapies also. There are certain oils available like emu oil, oregano oil. So they have seen that these oils give some kind of relief from this condition, but definitely it's better to consult your dermatologist and take the recommended antibiotics or azelaic acid as they recommend. So coming to the takeaway messages, we have seen how definitely sunscreen can be helpful in protecting your skin from these complications. You can try to cover your skin in the cold weather, so that you can try to use some gentle skincare products, because your skin might be sensitive because of the condition. Try to avoid stress, okay, sleep properly, try to get proper rest. So this is one more thing which is leading to complications here. And you can try your own coping strategy. There are some support groups also available where people are having this problems with rosacea. They discuss among themselves, they get some recommendations. So trying to cope yourself, trying to get some support also can be very helpful, because once these conditions are coming up, you might be very you might feel what do I say, you may have a lot of complications in you, like why my skin is happening like this, what should I do. You may have a lot of complications in your mind. So this kind of support groups gives you a lot of in-depth knowledge, and you can see how you can try to minimize your condition. So we have seen that this is a chronic inflammatory condition, and which leads to complications like facial flushing, skin thickening, eye symptoms are also there in type 4. So it depends on the complication of the condition. So currently there is no proper cure as such, but as I told you, the laser therapy or few therapies which I told you, that can be helpful in reducing the symptoms of this particular complication. So you need to understand what is the trigger in you. So once you understand or identify the triggering molecule which is leading to more flushing or more complications, you can try to avoid those food. Even certain times certain food might lead to excessive flushing and other things. So once you identify it over a period of time, you can try to avoid those food items so that those flushing and other problems can be avoided. So they have also seen that these people can have itching sensation in the skin, and once you start itching, you know, there in case there is pus-filled there, it can start spreading, and that can lead to more pus-filled conditions. So in that way you need to be very careful, and you need to speak to your dermatologist for more details on rosacea. So as a takeaway message, final takeaway message, I want you to tell you, please reduce stress and try to be happy. The condition will definitely reduce over a period of time. So thank you for watching. Do like my videos. Do subscribe to my channel Geeks and Geeks, and please share this video with maximum people so that in case anybody is having this complication of rosacea, this video could be of some help to them. Thank you for your support till date. Have a nice day.